I don't expect it to bleed on you, but we want it to be dry for any time that we go in here and clean it up. And you just have a little bit of scab left. Is that bothering you at all?
No.
Okay. Alright, we're just gonna, yep, good and straight. So, you know, where you see skin right now should stay the way it looks at this point in time, with just maybe a little bit more scar tissue growing in there. So we're going to mop up the extra chemical, and we just kind of apply a little pressure there. Is that hurting at all?
No.
Okay, so about 15 to 30 seconds each stick, enough to give that chemical time to do its thing and kill those, what we call little matrix cells. So you came in today with it looking absolutely great. No pigness or drainage or redness, which is great. But because I'm using a harsh chemical today, it's going to look worse tomorrow morning than it does right now, because your body's going to get a little bit of inflammation from what I'm doing. It's a burn. So down in the little pocket where the tip of the Q-tip is, it's going to have a little half-moon halo of redness, a little bit of puffiness, and it's going to start oozing more than it was before you came in. If you've ever had a burn, you know how they like to drain. But it'll be clear yellow oozing. It's not going to be anything that is pussy, creamy, okay? If it does turn thick, like pus, like when you pop a pimple, that's not good. We don't want that. So if you take good care of it and go back to following those directions that we had from the start, where you do a little bit of Epsom salt soak twice a day, and you flush it clean. And I don't know if you noticed that spray bottle that I use to clean off the soap on your foot. You can buy one of those in the pharmacy. They're just called Saline Wound Wash, and they're great because it comes out under pressure and it gets that saline down into this little groove. It helps clear up any dried crud or, you know, junk that's down in that little nail groove. So it still is going to get a little more irritated on you, but the fact that the infection is cleaned up, it'll heal a lot faster. She's going to dunk you with a little bit of alcohol to just kind of flush it out. But at home, make sure you're not wimpy, and you show that you're not by cleaning it well, but you still have to do a little of this, okay? You still have to wipe and get any kind of goopy stuff off of there. Just swishing it in the bathtub or swishing it in your Epsom salt soak isn't enough. You do have to give a little bit of a rub, okay? So look good. Let's just put a little piece of gauze on you today. So that little bit of white that you see there is actually, you know, just the chemical that touched your skin. So it's pretty strong stuff. So it's going to ooze a bit, but if you have a chance to get into a hot tub, into a swimming pool, something with chlorine or bromine in it, that helps immensely. That seems to do wonders to dry these things up. You put your head up. So if you got a friend with a pool, or you can make it. I'm not a big fan of public pools, but you know, even just dunking your foot in the public pool with the chlorine